Before we begin, this video is general health education, not personal medical advice. This is educational content, not medical advice. Tonight we'll explore what really happens when you sleep and how to sleep more deeply. Ever wake up feeling groggy after a full night's rest? That's not just about hours in bed. It's about the quality of those hours. Some nights leave you refreshed because your brain cycles through deep restorative stages, while others disrupt that balance. Studies show sleep quality can even affect conditions like eczema or flu recovery. But we'll focus on what you can control. Deep sleep is NREM Stage 3, your brain's deepest repair phase. It consolidates memories, locking away what you learned, and helps muscles recover by releasing growth hormones and cleaning up daily damage. Without enough, you may feel groggy or forgetful even after long sleep. When you sleep, your brain isn't resting. It's actively working to keep you healthy. Your night includes cycles of light and deep sleep, plus REM, rapid eye movement, where vivid dreams occur. The hypothalamus, a tiny region deep in your brain, acts like a thermostat for these cycles. During illness, like the flu, it may adjust your sleep to help fight off infection, making you feel extra tired or feverish. While most people recover fully after clearing the virus, severe infections can sometimes lead to long-lasting neurological issues like narcolepsy. Though these cases are rare and not yet fully understood, deep sleep is fragile stress. Late-night screens or regular schedules can fragment it. Excess cortisol from stress disrupts deep sleep, while blue light misleads your brain into thinking it's daytime. Irregular bedtimes confuse your body's internal clock, leaving you groggy despite long sleep. These disruptors don't destroy sleep, but make it harder to reach restorative phases where your brain recovers. You've heard sleeping like a baby, but newborns don't sleep deeply. Their brainwaves show frequent light sleep phases, not the deep restorative sleep adults need. Stress or screens can disrupt this pattern by fragmenting deep sleep, but it doesn't vanish entirely. Non-pharmacological strategies, such as consistent bedtimes and reducing blue light exposure, are recommended in guidelines to support deeper sleep, though research varies on their effectiveness. Your brain learns best when it has a routine like brushing your teeth or doing homework. Going to bed and waking up at the same time every day trains your internal clock, making deep sleep easier. A wind-down routine like reading or light stretching signals your brain that it's time to rest. Avoid caffeine after noon or alcohol close to bedtime. Both can fragment deep sleep by disrupting chemicals like adenosine, which builds up during wakefulness, and melatonin, your body's sleep hormone. Blue light from screens tricks your brain into staying alert, so dim lights 1-2 hours before bed. These small changes don't cure poor sleep, but make it easier to reach the restorative phases where your brain cleans up and recovers. If you've tried consistent sleep routines like keeping the same bedtime and avoiding screens before bed and still struggle to feel rested after a full night's sleep, it may be time to talk to a doctor. Persistent insomnia, where trouble falling or staying asleep happens most nights for at least 3 months, is a common but treatable condition. Other signs to watch for include excessive daytime sleepiness that isn't relieved by naps, sudden muscle weakness like your knees giving out, or hallucinations while falling asleep. These could point to conditions like narcolepsy, which affects how your brain regulates sleep. A doctor can help rule out underlying causes and guide you toward evidence-based strategies, such as cognitive behavioral therapy for insomnia, CBTI, which is the first-line treatment recommended by guidelines. Ever notice how some nights leave you feeling refreshed while others leave you groggy? Your environment plays a big role in sleep depth. Blue light from screens suppresses melatonin, the hormone that signals your brain it's time to wind down. Even dim light can disrupt deep sleep phases where your brain cleans up and recovers. Noise, especially sudden or loud sounds, can fragment sleep, reducing restorative stages. Ideal room temperature is around 65 degrees Fahrenheit 18 degrees. Too hot or cold can also shallow sleep. Small tweaks like blackout curtains, white noise, or adjusting thermostat settings make it easier to reach deeper, more restorative sleep. Deep sleep isn't just about feeling rested. It's a crucial time when your brain cleans up toxins linked to diseases like Alzheimer's, H6. During deep sleep, your immune system also gets a boost. Studies show that people with skin conditions like eczema often have disrupted sleep and inflammation. H3. Chronic deep sleep deprivation may raise risks for cognitive decline or immune disorders, but lifestyle tweaks like maintaining a cool, dark room can support deeper rest. These changes aren't cures, but they're evidence-backed ways to protect long-term health. You've probably noticed that some people seem to sleep less than you do, but still wake up feeling sharp while others log 8 hours and feel like they ran a marathon. That's not just luck, it's partly genetics. Some folks naturally need less deep sleep time, so their brains recover efficiently even on shorter rest. But here's the catch. Research is still figuring out exactly how much sleep each person truly needs. Current guidelines suggest 7 to 9 hours for teens, but individual needs can vary. If you're one of those rare people who thrives on 6 hours, it might be your biology, but don't count on that lasting forever. Age, stress, or health changes can shift what enough sleep means for anyone. For now, the best approach is to listen to your body and aim for consistency, knowing that deeper sleep still packs the biggest punch for long-term health. Tonight, try a 5-minute breathing exercise. Inhale for 4 counts, hold for 4, exhale for 6, 2. Calm your nervous system and ease into deeper sleep. This isn't a cure, but research shows it can help protect long-term sleep health by reducing stress triggers like racing thoughts or shallow breathing that disrupt rest. If you wake up groggy despite consistency, note whether screen time before bed or irregular schedules are risk factors. Small tweaks like dimming lights an hour earlier can support deeper cycles over time. This is educational content, not medical advice. While we've explored how sleep works and ways to deepen it, remember that individual needs vary. If you're concerned about your sleep like waking up exhausted despite consistency, note potential triggers like screen time or irregular schedules. Small tweaks can support deeper cycles over time, but always consult a healthcare provider for personalized guidance. For now, try the 5-minute breathing exercise we shared. Inhale 4 counts, hold 4, exhale 6. It's not a cure, but research shows it may help protect long-term sleep health by calming your nervous system and reducing stress that disrupts rest. Stay curious, but listen to your body. Remember, this is general health education, not personal medical advice.